Dr. Maryanne McGuckin, thank you for talking with me today. So, you are the co author of the Patient Survival Guide, 8 Simple Solutions to Prevent Hospital and Healthcare Associated Infections. Why is this book significant?
Well, I think the main reason this book is significant is the fact that whether we like it or not, we're all going to become patients, whether in the hospital, in the clinic, in a surgery center. And we know right now that a little under 2 million hospital-acquired infections occur each year. So there's about 1.7 million people get infected with organisms that they didn't have when they went into the hospital and they acquired it in the hospital. There's a tremendous amount of these infections that can cause significant mortality and morbidity. And we know that about two-thirds of these infections occur in the population, the Medicare population. So it's definitely a significant problem, and probably one of the reasons why, I decided to write this book. In my 30 plus years of being on the faculty and the staff at the University of Pennsylvania, doing a lot of research and clinical work, I began to realize that we aren't making a real impact on this situation. And actually, it is referred to as a global problem. And looking at this, I began to realize it seems that the one thing that was missing in all of the equation in terms of trying to prevent this was the patient. They have a vested interest in doing well, and we have moved beyond the age of Marcus Welby, MD, the country doctor. We're now more like Dr. Oz, and people want to be empowered. So I decided that one of the ways we can empower them to prevent these infections is to give them the skills and knowledge that we as professionals know, and realizing that there are some basics, simple things that they can do as patients to almost ensure that they won't get an infection. Because the incidence is about 5% of patients will get an infection, just by being in the hospital. And the main reason that people get these infections is because of a simple lack of following guidelines and also of hand hygiene.